Hello, viewers. I hope you have liked, put into action all the points we discussed last time. We had an elaborate discussion on nutrition in cancer survivors. It was a very in depth coverage. We spoke about various things, right from what kind of nutrition one should use to what are some of the care one should continue whilst, post treatment. So a lot of discussion around this was also done. We also spoke about the role of various micronutrients, which are very important to continue even post the treatment, so that there is proper post rehabilitation. Today we are going to be in conversation with yet another young enthusiastic dietitian, and today we're going to speak about the role of carbohydrate, different kinds of carbohydrate, and why they are so important in this entire process of rehabilitation. So stay tuned, and lots of information coming your way. Hello, today we have Miss Nishat Taliya, a consultant dietitian at the Medicover Cancer Institute. This young dietitian has achieved a lot. She is one of the favorite dietitians for most patients because she kind of decodes all this complex nutrition into a simple, easy format which most patients can follow it. So, welcome Nishat to today's show, and thank you for being here and sparing your valuable time for all these pep talks. Like,
Hello, thank you for having me.
yeah, like Nishat, we do these programs so that all our patients can really benefit from this entire dialogue, and especially getting a lot of expert advice from somebody who's well experienced and working in onco-nutrition like you. And today our topic is role of carbohydrates and energy, and there is a lot of cross talk about keto diet, low carbohydrate diets, and how all of these diets can really benefit, especially in different stages of cancer. So, Nishat, what are some of your first thoughts that is this preconditioning nutrition therapy actually required? Preconditioning for viewers means before the treatment actually begins. Okay, that part is called preconditioning. So, Nishat, if you can just decode for us how this entire preconditioned nutrition therapy actually is an important one, and what should patients do? What kind of carbohydrates should they choose?
Okay. So, as we all know that cancer is the second leading cause of death, and 1 in 6 deaths are due to cancer. But what we not aware of is that 30 to 60% of the cancer could be prevented by following some evidence-based preventive strategies. Okay, so this preconditioning nutrition therapy is something new, and basically this preconditioning means that preparing the patient for the treatment. It's just like gearing up the body for the treatment, where we prepare the patient nutritionally for the treatment by providing the right amount of nutrients. Though there's not much evidence or there's not much studies on it, but it has the potential to improve the quality of life and also enhance the treatment.
That is beautifully stated. That just as before, Nishat actually spoke very clearly that you're preparing your body. It's a preparatory stage because all cancer treatments are intensive and aggressive. So you are actually preparing your entire body for this stage. So that is, I completely agree with that, Nishat. And so when we look at carbohydrates and we look at energy, is there a role of calorie restriction, or is there a role of especially carbohydrate restriction? Does a reducing carbohydrates, like there have been a lot of studies which say that if people who are eating a lot of sugar, and the MRI scans show that there is growth. So there are a lot of myths amongst patients. So what are your thoughts on that?
Okay, see, not just for the cancer patients, but for everyone, carbohydrate is the main source of energy. And same like the other cells, cancer cells also derive their energy from the glycolysis. That is, glucose is the primary fuel. But clinically, we don't practice the carbohydrate depression therapy. We more focus on the individualized based patients nutritional therapy, and it's the diet is more of individualized based because every patient is different, and there is a lot of catabolism in cancer patients. So we can't just put everyone on carbohydrate or low carbohydrate or no carbohydrate diet. Okay, so the choice of carbohydrate can be complex carbohydrate rather than the refined or simpler one. But the about 40 to 60% of the total calories can be met from the carbohydrate.
I completely agree that the need of carbohydrate needs to be individualized based on the person's current body structure and what kind of treatment he is taking. Also, I think the choice of carbohydrate is very important.
Yes.
So Nishat spoke about simple carbohydrates and complex carbohydrates. Simple carbohydrates are all the carbohydrates which are fast absorbing, like your sugar, honey, jaggery, potatoes, rice, maida. Vis-a-vis those which come from whole grains, whole fruits, vegetables, pulses. So what if I'm decoding this correctly, Nishat actually means to say eat plenty of whole foods so that we get a lot of complex carbohydrates, which is still a fuel, but it will also give us a lot of antioxidants and will reduce the overall simple sugar load on the body.
Yeah. That will also help you in managing the weight. That will provide you the energy that your body needs for the treatment and during the disease. And it also helps you to meet the amount of energy requirements that you have.
Absolutely. Thank you so much for that, Nishat. So moving on to the next question. My question is, in weight losing cancer patients with insulin resistance, do you think that the ratio of energy from the fat to energy from the carbohydrates should be changed?
See, not really. Even in the insulin resistant patient, the cancer patient are more catabolic, and there's a lot of catabolism. There's a lot of weight loss can be seen. Not in every patient, but most of the patient. And malnutrition is very common problem. Around 30 to 80% of cancer patients are malnourished patients. So again, it's an individualized base, but the amount of carbohydrate, the energy from the carbohydrate is around 40 to 60%, whereas when it comes to the fat, it's 20 to 30% of the calories should be from the fat.
Correct. And today, Nishat, there has been a lot of talk on good fat and fat coming in from better sources like your nuts, your seeds, which also have a lot of anti-inflammatory property and omega-3. So probably if we are able to shift the simple carbohydrates to like good fat, probably that's a good exchange, right? For patients.
We can't, it's better to include the good fat rather than changing the nutrient or depending on some other nutrient. If you're choosing carbohydrate, prefer complex carbs. If you're choosing fat, in that fat also there is a red meat that it's not advised to consume red meat every day. Instead of that, you can stick to chicken, fish, lean meat, eggs, milk. Fish is again a good source of antioxidant. It's really a good source of omega-3, which is anti-inflammatory. So choice of the food ingredient can be different, but it's good not to replace the nutrient.
Right. So what Nishat actually saying that if it is a carbohydrate, choose from the carbohydrate exchange. You can choose different kinds of carbohydrates. So choose more complex carbohydrates from the same exchange list rather than shifting the nutrient. Very well spoken, Nishat, over there. Then what is your view on ketogenic diet, especially as a pre-rehabilitation thing, especially in terms of patients who don't need who are not really losing weight. They may be overweight to begin with, especially in conditions like breast cancer, cervical cancer. Do you think carbohydrate restriction there would help? And there have been a lot of clinical evidence as well.
Okay. Ketogenic diet is really high. It contains a high fat and approximately 70%, and primarily saturated fatty acids. Okay. And is very low in carbohydrate. Okay. But there are not enough clinical studies which support that the ketogenic diet or the low carb diet is the best choice for all the cancer patients. Still, we need more studies on that. And other than that, the acceptancy is also a problem, as the diets are really high in fat. It cannot be palatable, as the cancer patients will be having change in taste, change difficulty in swallowing. High saturated fatty acids are not that palatable as well. And depriving ourselves from the carbohydrate is not a really good idea. And because even if we deprive ourselves from the carbohydrate, the other source, that is fat, our body uses fat as a source of energy. Okay, so it not works for every patient.
I agree completely that you need to differentiate who are the people who are wanting to. Probably if you want to go low carb, using some kind of supplements may be a good idea, which are very low in carb, high in protein, high in complex carbs, and that kind of a replacement can actually fit the bill very, very well.
Yes.
Um, so a lot of confusion regarding sugar. Even if you look at social media pages, sugar seems to be like the demon. And so your thoughts on that? Should sugar be completely restricted, or can we allow patients to kind of take some amount of sugar?
Okay, there's a lot of confusion about this, and but there's no evidence that this going sugar free or going on a sugar free diet will improve the quality of life or the chances of surviving. The idea how it arrived that the sugar, the cancer feeds on sugar is from, as most of the cancer cells require a lot of glucose, same like other cells. So now they think that the cutting down the sugars will help them cancer cells to stop growing. Okay. Unfortunately, it's not that simple. We can't say our bodies to have. We can't say our bodies to get the glucose. We can't say healthy cells to get the glucose and not give it to the cancer cells. So it doesn't have good evidence on it. The sugar requirement or recommendation is same for the cancer patient as it's for the normal individual.
That's the benefit of talking to a qualified nutritionist who is very intelligent on patient management, and those are great answers, Nishat. Like Nishat actually said, and I'd like to reiterate that it is nice to go low on sugar, right? Use it only, and that is not only in cancer, but overall that's a lifestyle measure which we try to give all our patients, because even at various government levels, policy levels, we have been working on the high sugar, high salt, high fat concept. So definitely reducing sugar is important. Wherever you're using added sugar, especially chai, coffee, try to reduce it. Okay, if you can have a cup of tea and coffee with less than 1 teaspoon of sugar, great. If you can get adapted to using no sugar, fantastic. Yeah. So I think these are, rather than having a huge debate and creating so much of a confusion, I think it's a matter of more lifestyle changes. And a good dietitian can actually help you to sail it. And honestly, once you get used to it, you don't really require more. You eventually get used to
the sugar that we need from the fruits, vegetables, and all. We don't need to add it extra, the table sugar.
Correct.
That we don't need.
Yeah. So you enjoy the natural sweetness which comes from the fruits as a natural fruit. That is completely okay. But don't go overboard on added sugar. Completely got your point there. And so whilst you also spoke about complex carbohydrates, and the most scientific term which we often use is prebiotics, right? So can you tell our viewers and elaborate a little more benefits on why prebiotics are really required? How can we incorporate them through the diet?
Okay. Prebiotics are nothing but the fiber. It's a type of fiber that human body cannot digest it. So it acts as a fertilizer to our gut healthy bacteria. Okay. It aids our digestion. And other than the complex carbohydrate, any carbohydrate source that is good source that has fiber, for example, of fruits, vegetables, onion, tomatoes, wheat grain, banana, green leafy vegetables, etc. All this acts as a carbohydrate. So it's really the recommendation is same as the normal individual. For cancer patient, it's not extra, but we don't consume the enough amount of green leafy vegetables or the vegetables that we should. Okay, the prebiotics which improves the gut bacteria also improves our immune system. It also helps in the nutrient absorption. It aids the digestion, especially it helps in the calcium absorption. So it's really important to have all the colorful vegetables, green leafy vegetables, fruits in our diet.
Yes, very well spoken there, that all prebiotics are fiber. Okay, they are also a substrate on which the good bacteria or the probiotic bacteria grow. Like Nishat used the term fertilizer. So they actually form a base for all these good bacteria to grow. And it's a very important thing today. Gut health is one of the most important issues. And if the gut is clean, and if the gut is able to generate a lot of good bacteria, overall we see a lot of disease control. We see a lot of benefits of better gut health, great immunity, like Nishat said. So these are all fallout benefits of having a high prebiotic diet. So she also gave some great examples on how we can include prebiotics on a regular basis. So I think very important that we eat our 400 grams of vegetables every day. Make sure that we eat at least
You can go up to 500 grams per day.
Yes, you can also go minimum 400. You can even go up to 500 grams. Include at least one green leafy vegetable. Okay. Eat your rainbow is a simple formula wherein you try and increase at least 4 to 5 colors wherever possible in a day. And whilst you're getting your antioxidants, you're also getting prebiotics, like Nishat really has spoken. And it's a great way to go healthy and also start improving, especially on a condition where you are in a prehabilitation stage, and moving on next, you'll be just about to start all the treatment mechanisms. So yeah, fantastic. So Nishat, how appropriate is the diet? Like, look at anti-cancer treatments related, they have a lot of side effects. And also somewhere the treatment itself starts out affecting the treatment outcomes. Yeah. So how would you, as a nutritionist, what are your final takeaway points for our patients, that you think that they can really sail through, starting from a prehabilitation stage and then sailing through all the treatments and still coming out in a great shape to be a great winner?
Okay. As you said, there's a lot of side effects that the cancer patients face from the treatment. That can be nausea, diarrhea, loss of appetite, dysphagia, that is difficulty in swallowing. There's vomitings, there's diarrhea. There's also, many chances of getting infected because their immune system is weakened. So first comes the role of food safety. It's really good, important to washing the foods before eating and avoiding cross contamination of foods. Apart from that, as a dietitian, I suggest for cancer patient a healthy and balanced diet, which has a lot of complex carbs, that is coming from whole grains, cereals, millets, and protein. Protein is again a really good source, as there will be a lot of muscle mass and loss of subcutaneous fat, muscle wasting is there. So 50% of high biological protein and 50% of low biological protein, that can be from legumes, pulses, grams, and eggs, fish. As I told, it's a good source of omega-3, can be consumed. Small and frequent meals, 5 to 6 meals can be consumed instead of having 3 big meals. And a good amount of, most important, a good amount of your fruits, vegetables, and green leafy vegetables. Try to incorporate as many colors as you can include in the diet. And you can have it in the raw form, or you can have it in the cooked form. Anything is fine, but half of your plate should be filled with your vegetables and greens. And then comes your healthy fats, that is your nuts. 3 to 4 teaspoons of nuts can be included in the diet. That can be almonds, walnuts, pine nuts, peanuts, anything. Okay, and then the choice of non-veg should be more of lean protein rather than the protein that is high in saturated fats. So consumption of red meat or organ meats on a daily basis or very frequently is not advised. And try to avoid the highly seasoning, highly flavored, strong flavor foods, because there will be chances of the nausea, vomiting, and this can aggregate it. Okay, and hydration is also really important. So make sure you keep yourself hydrated and include fluids in the diet, but avoid the excessive sugary drinks and caffeinated drinks, which can lead to diarrhea, as that is also one of the side effects.
Those were some absolutely fantastic points, Nishat. So Nishat began right from food safety to how you can actually build your plate, where she said eat half of it as raw or salads or vegetables, half of it as cooked. Then you include your dal, pulses, and all your proteins, and 1/4 will be your cereal part. Preparing your body for either chemotherapy, radiation, or surgery is an important part here. And but she also mentioned another very important point is keeping yourself away from infection. Yeah, so probably at this stage, slightly, instead of raw vegetables, steaming the vegetables or slightly roasting the nuts, because they may be having a lot of some kind of a fungus or seeds slightly roasted, may be great options of not only including fiber but also including good fats in the diet. So great points there. Also, I think Nishat made this very emphatic statement about increasing it with food safety. So typically we think that okay, carrying a fruit juice may help, but if you're straining the fruit juice, you are actually extracting the fiber out of there. So if you're having your juices, if you're having your soups, try to have it whole, don't strain it. You can either blenderize it, or if you're having a soup, have suspended vegetables so that you get some flavor. Don't strain it. Also, don't keep it for a very long time, because the moment the temperature changes, the risk of contamination is higher, and that may create a lot of load to the body. So great points, Nishat. And one final message to all our viewers before we log out today.
Okay, eat healthy, balanced diet. Divide your plate into 4 parts. 1/4 of your plate should be filled with your carbs, preferably complex carbs. 1/4 of your plate should have good amount of protein, high biological as well as low biological proteins, and half of your plate with your colorful, all include all the colorful fruits, vegetables. Your plate should look like a rainbow. So eat well, stay fit, and definitely there should be 30 to 60 minutes of any type of physical activity is also important in your daily routine.
Thank you.
Stay well.
Thank you so much for all these great messages. I think exercise, again, Nishat, like you said, that most of the times we say we are tired, but every physical activity is important, because it also helps a lot in muscle regeneration, and it keeps you going back to the original fitness level. It will also open up your mind and keep you in a more better positive health, because exercise also releases a lot of endorphins. So I completely reiterate all your points, and it was great having you, and all you viewers stay tuned for more episodes coming your way of healthy eating during treatments, before, after, and we'll have more experts just like Nishat joining in soon. And Nishat, we hope that you can join us again for yet another session, and it was a pleasure having you today.
Same here. Same here. I'm looking forward for more.
Yeah, thank you so much, and stay safe, stay healthy.
Thank you. Bye.